This segment is sponsored by Endoscopic Wellness Center of America. Obesity is a national epidemic and a major cause of death in the United States. The Chief Medical Officer of Endoscopic Wellness Center of America, Dr. Richard Allen Blosser, says endobariatric procedures can be a way to help patients lose weight. Dr. Blosser, so great to see you again.
Good morning. Thank you so much for having me.
You all at Endoscopic Weight Loss Center of America, how do you help your patients lose weight? What are some of the resources you have?
Great. Thank you for asking. The issue at hand is that we do what is known as endobariatrics. And with endobariatrics, we start off with the premise that we're doing things lesser invasively, so almost non-invasively, incorporating a full year of wellness and dietary training after the intervention. So we have balloons, we have ways to manipulate the anastomosis or the connection in patients who previously had bariatric surgery. And then we have the endoscopic sleeve, which is done the endoscopic version or the lesser invasive version of a sleeve versus the bariatric surgeon. So we incorporate endobariatrics, lesser invasive type procedures with a full year of wellness and nutritional training.
The lesser invasive procedures, but what else does that mean when it comes to recovery for endobariatric procedures?
Yeah, that's very important. These are all same-day procedures that do not require hospitalization, do not require antibiotics, all done endoscopically. We are very familiar with colonoscopies for colon cancer screening, and endoscopy is just the upper version of that, where we look into your esophagus, your stomach, and your small bowel with the help of an anesthesiologist to keep you asleep. And these procedures take 10 to 15 minutes. They do not require a whole lot of other preparation other than nothing by mouth the night before. And at the end of the day, we either put a balloon in to occupy space in your stomach, or we actually sew the stomach tight, the lumen of the stomach, the opening of the stomach, and make it smaller so that you just can't consume large quantities of food. So by occupying that space and or reducing the volume of the stomach, we dramatically reduce the caloric intake, and ultimately with the training and the post-op management, patients lose weight and keep it off enduringly. We now have 5-year data showing that both the ESGs and the balloons are outstanding performers with regards to long-term weight loss.
It's just remarkable, the technological advances in medicine, that you can do something like this in one day for somebody and they can start living that life of theirs.
Absolutely. All the patients go home the same day. There's no hospitalization. Wow. The vast majority are back to work the next day. There's no antibiotics. There's no pain medication. Maybe some patients may get some anti-nausea and antispasmodics just as to help them through a day or two. But again, the program begins literally the next day with the nutritional guidance, liquids almost invariably for the first few days, and then the program kicks in. But at the end of the day, it's about lifestyle modification. It's about behavior changes, and it's about changing the lumen of the stomach so that either by the balloon occupying space or the ESG reducing the volume of that you physically can't eat the large volumes of food that you could before. And with that behavior modification then becomes the weight loss and the long-term maintenance of that weight.
What is the criteria for the gastric balloon procedures? How does somebody know that they might even be a candidate?
Yeah, it starts off with a simple measurement of the weight, and we calculate what is known as the BMI. And the BMI is a mathematical calculation, really, and is approved for anybody with a BMI grade. 25 to 30 is considered overweight, but 28 to 40 are considered obese, overweight or obese. And these are the candidates who are very good patients who benefit from the balloon. Patients who have a BMI greater than 35 and comorbidities, i.e. blood sugar elevations, diabetes, hypertension, and the such, they are much better candidates for the ESG because that's a long-term fix. We know that obesity not only is a risk factor for coronary artery disease, for high blood pressure, for kidney failure, but it's also considered a carcinogen for increased risk of all types of malignancy. So when you have a BMI of 35, i.e. 50 to 60 pounds over your ideal body weight, losing that weight is probably the single most important thing you can do for health, short of taking the medications for your blood pressure and diabetes. But invariably, as you lose that weight, your blood sugars improve. You may no longer be a diabetic because the vast majority of people we see are type 2 diabetics.
Right.
And the blood pressure as well may improve. So all of this starts with losing the weight first.
Well, you have options for many different patients in many different parts of their life. Dr. Blosser, thank you for sharing it with us. So great to see you.
It's so good to see you. Have a great day.
You can go to their website, ewlca.com, to request an appointment. You'll get a consultation with their team of experts who will be able to help you kickstart your weight loss journey.